for joining us this evening. We are going to go ahead and get started and get the rest of our panelists and moderator funneled in here. Thank you for bearing with us through these technical difficulties as we are working through our COVID-19 pandemic style of event. So my name is Kristen Hobbs. I am the Senior Project Manager of Quality Improvement and Equity at the National Minority Quality Forum Center for Sustainable Healthcare Quality and Equity. And I'm so excited that you have decided to join us this evening for our vaccine equity webinar. We will be using or talking about tools that you can use to increase vaccination uptake in communities of color and any of the communities that you serve. So before we get started, I really want to take care of some housekeeping items. You are webinar attendees and you're currently in listen only mode and your audio or your videos are turned off. We ask that you place all of your questions in the Q&A box. Now this will help us streamline the Q&A portion of our webinar for our moderators, but we do want to encourage healthy and respectful conversations in the chat box. So please use the chat box to network, to comment, have those healthy conversations. We'll be dropping links, pertinent links to all of our presenters' social media sites and websites, and some pertinent data as well throughout the webinar. So please look out for that in the chat. You should have transcription at the bottom of your screen. If you do not see transcription at the bottom of your screen, you can activate this by clicking the live transcript. It has a CC icon at the bottom of your Zoom panel, and you should be able to see transcript. You can show subtitles or you can show the full transcript, whatever works for you. So again, we're here to try to increase vaccination uptake by talking about tools that some of our panelists are using, have been using in their work. Hang on one second. I was spinning for a moment. I'm glad you guys can still see me though. I really wanted to first start off by introducing Dr. Beysolow and having her tell us all about herself. She's one of our moderators today. Dr. Beysolow came to us in our Champion Collab as a part of this NMQF Health Champion work to increase vaccination uptake in communities of color. So I'll turn it over to you, to Dr. Beysolow.
Good evening, and thank you so much, Kristen. Again, I'm Dr. Iyabode Beysolow. I'm a pediatrician with over 20 years of experience and also a public health expert. I worked for several years at the Immunization Services Division at the CDC as a medical officer, really working on the childhood immunization schedule, but also educating communities around the nation about vaccination. And I currently serve as a consultant for AIM, the Association of Immunization Managers, where I provide technical expertise, as well as for other entities, including the WHO EUR region. So I'm really excited to be here today. And with that, I wanted to introduce our other panelists. I'll be serving as moderator this evening. And I wanted to introduce you to two of our panelists. The first is Dr. Glenna Crooks, who is a strategist and trusted counsel to business and government leaders. She has addressed vaccine issues since 1981, first as a presidential appointee, then as the Merck Vaccine Business Global Vice President, and as founder of her own firm advising businesses and governments globally about vaccines. Most recently, as co-founder of Global Vaccination Advisors, she co-produced the Vanguard Vaccination Project. She's received awards for her work, including the Surgeon General's Medallion for her contributions to public health, as well as awards for her work in orphan drugs for people with rare diseases and in senior caregiving. She was also named a Disruptive Woman to Watch. Also want to introduce you to Dr. Dan. He is a distinguished emergency room physician, biodefense expert, chief medical officer, and war veteran, assistant professor, and a media expert. He provides strategic leadership in public health literacy, disaster preparedness, biodefense, and business continuity of operations, both on a national and international scale. He's also served as medical director for disaster preparedness at the Children's National Health System. He's one of the youngest African Americans appointed, actually the youngest, by the U.S. Secretary of Health and Human Services under Obama administration to the National Biodefense Science Board to provide expert advice and guidance on complex issues of preventing, preparing for, and responding to the health effects of public health emergencies. He's authored and co-authored various medical literatures, as well as delivering expert testimony to the bipartisan committees on the Hill as needed. And he loves to provide easy to digest, timely, tangible public health information and education. So what we'll do now is turn to our esteemed panelists. We're in for a treat this evening to spend a few minutes asking them to each share the work that they do in advancing improvements in communities of color in the realm of COVID-19 disease and vaccinations. And so with that, I'll go ahead and start with Dr. Dan this evening.
Hi, can you hear me?
Yes, we can hear you. Thank you.
Hi, good evening. Thank you for that warm introduction. And thanks for all the staff that put this together and for the audience that's with us. So as was stated, my background is in emergency medicine, public health, pediatrics, all of that good stuff, and also a military vet. In some of this work, what I'm seeing, at least what I'm doing now, is trying to engage the community and partnering with different groups to try to meet people where they are, so to speak, and make sure we provide, of course, tangible, digestible, understandable, accurate information for them, but also understanding the nuances of this response to this novel pandemic, right? So those are some of the challenges. And then in the emergency department where I work, where the rubber meets the road for me, clinically, is getting to know the end user and tackling those issues. What are the end users, the patients that come in with flu-like symptoms or viral symptoms or other acute emergencies, from heart attacks to difficulty breathing, a seizure, some injury, a car crash. So different levels, but you all have to be kind of aware of those nuances in a pandemic. So those are kind of some of the things I'm seeing. And so how we message that, how we address that, how we address the vaccine hesitancy, or how we empower people to be a part of the vaccine equity, how we partner with the Center for Sustainable Health to be able to recruit and partner with different health champions, so to be an advocate in public health. So we have a lot of those things which are in works and currently being done in the community. But yes, thank you for allowing me to speak.
Excellent. Thank you, Dr. Dan. And we'll delve deeper into some of those themes that you mentioned in a few minutes. Wanted to turn now to Dr. Crooks and ask her to share a little bit of her work.
Yes, thank you. After those several decades of working on vaccines in government and in the private sector and globally, I sort of retired from that to do another major project. But I came out of vaccine retirement with the advent of COVID and have been advising a number of people in government since. And with Sherry Fox, co-founded Global Vaccination Advisors. Our purpose is to help fill the gap of the commercialization efforts that companies usually do that they did not do in the context of Project Warp Speed. Now, the major project that Global Vaccination Advisors has had is to work with the Vanguard Leadership Forum. These are executives in life sciences companies, and to co-produce 9 episodes to help business, nonprofit, and civic leaders to arm them with short, simple, toolkit kinds of ideas and materials to address vaccine hesitancy and improve immunization rates for COVID-19. Now, all of these are available, and I know that you're going to put a link in the chat. We launched this Netflix style. There, if you go look at it, you will find videos, podcasts, and articles. If you are short on time, I would direct you straight to the articles, because it not only includes everything that is, in the videos and the podcast, but also more material that was left on the cutting room floor when those were produced. In addition to that, we include a set of resources that are all free and available. Now, as part of our series, NMQF executives participated. So one episode is Dr. Gary Puckrin and his innovative work in understanding zip code relationships with health. And then the other is with Dr. Laura Lee Hall. And among the tools that we are offering is the Health Champions Toolkit that you talked about. Now, something else as well, Sherry and I collaborated with a group of market researchers who are all part of an organization, a professional society called Intellis. That particular group designed and tested masks to inform people about how to correctly wear a mask, both in terms of the graphic image and in terms of the text of that image. So it was actually tested and demonstrated that these are the two most effective posters to put in a window to encourage people to appropriately mask. Now, since we're not out of mask territory, these still have utility. And in addition to that, I would want you to know is that they have been translated into 27 languages. So part of our resource set also includes those masks. And I make a final sort of offer. If anyone listening in to this webinar has any particular resources, materials, toolkits, messages that they would like us to include in this resource guide, we will be more than happy to take a look at them and to include them. My address, I'm sure, is in your chat, and you can feel free to reach out directly to me.
Great. Thank you, Dr. Crooks. I really appreciate both of you sharing that. Just wanted to make sure Dr. Fitzpatrick, if she has had an opportunity to join us, we had a little technical glitch. So if she's on the call, please join. If not, we'll come back to her. But again, we've kind of set the framework for further discussion this evening. And as we think about vaccine equity and what that means in the setting of the COVID-19 pandemic, several themes emerge. So let's take a moment to start with one of them. As we know, the US COVID-19 vaccination program, since December of 2020, 63.2% of the total US population have received at least one dose of vaccine. 54% have been fully vaccinated. However, we are still continuing to see disparities in vaccination by race, with the share of white people being vaccinated much larger than the share in communities of color. So to our panelists, if you can please share your thoughts on these numbers. Have you noticed an increase in vaccination rates in your communities in light of the newly approved FDA Pfizer BioNTech vaccine, as well as in the context of the rapidly spreading Delta variant? So I'll start with you, Dr. Dan.
Yeah, so we're hearing grumblings is what I best can say of people getting vaccinated due to mandates and certain other things that are being put in place, and literally having some discussions, not as much in the emergency department. I think when they usually present, it's a little bit too late, although some do ask when they have, maybe a relative that's sick or a child that's sick, they'll say, I've been considering it. If it's positive, should I still get the vaccine and all these other things? And I'm like, yeah, you need to talk to your doctor, but definitely we would encourage you getting the vaccine. You're here. And of course, if you have symptoms, you need to go check with your doctor. So I try not to give them too much medical advice, but more so the information, and then they can act on that. With that. But yeah, so that's what we're seeing, some uptick. But I'm also seeing some who are still digging their heels, who are definitely saying that, and this is on the social media outlet side, where we're having discussions in different outlets, be it on Twitter, Instagram, or on Clubhouse, or whichever other tools that I'm on, even on a Zoom call, and you kind of hear that hesitancy, mistrust, or violation of trust by the government or by the medical system. So we're whichever way you look at it, there's still some apprehension about that whole process, and people still learning or figuring out what they're comfortable with. So that's what I'm seeing.
Great, yes, and thank you for sharing that. And you mentioned some of the issues such as access to vaccines or concerns about safety and mistrust as some of the issues that you're hearing brought forth. And in your line of work, Dr. Crooks, are you hearing any emergent themes as far as barriers to vaccine confidence?
We clearly did in the episodes that we produced, and web access was one, and transportation to mass vaccination centers was another. And I would say that the complaints that I heard were not just from the Nordic communities, but from all communities, that it was a challenging way to get a vaccine, in particular because what this particular methodology did at these mass vaccination centers was interrupt the trusted connections that people, and I would be one of them, would have very much preferred to get this vaccine from my physician or from my pharmacist. And as situation would have it, I wasn't able to get an appointment at a mass vaccination center, and I was able to distance enough that I was safe until the vaccines were available in a local pharmacy. But there are other things too. Unlike me, because I'm not caring for children at home and supervising their learning and perhaps even trying to do a job or several, during a pandemic like this, people have other day-to-day responsibilities. So even if they could make the appointment and try to get there, another priority was easily and often in the way. Now, one of the things that one of our guests commented about, he is the chairman of the board and CEO of Atria Healthcare. This is a senior living community. There are 200 of them across the US and Canada. He decided, as soon as they knew a vaccine would be available, it was the end of 2020, he decided to mandate the vaccine. Now, according to him, the particular barrier had nothing to do with politics. It had to do with muscle memory, he called it. He said young people didn't live through smallpox and they didn't live through polio. And so and of course, many of them were immunized by their parents, so they did not even suffer the consequences of what we used to call childhood diseases, even though, as we know, they're quite serious. So, so that was one of the key barriers that they faced. No question about systemic racism in healthcare. That came up in the work that our guest talked about. And then there's something else that I personally would never have known, and that is that legal immigrants fear that if they accept a free vaccine, that will count against them because they're on the public purse when they go to apply finally for citizenship. And so one of the things that had to be communicated within that community was the fact that it will not count against you at all. And then finally, there's the rumors. And one of our guests was particularly compelling. She's an anthropologist, and what she does is study rumors. And her lesson was instructive. She said, rumors emerge when there's a vacuum of information. When people they have questions, but they don't have answers. And as a result, it is easy for rumors to take hold. So those were some of the principal things we saw. There's one sort of related, it didn't exactly come up, but it was a lesson learned about how to overcome barriers. And again, it was from Atria Healthcare. The vaccination events that they had weren't just one and done. it took a period of a number of vaccine sort of clinics at their facility to get it all done. What that did was allow people who were hanging back and being resistant to sort of see their colleagues and the patients eventually immunized, and to see that they were okay. So the idea that, to the degree you can pulse through an opportunity to be immunized like that, so that people see, and especially since, given what the president has just promoted in terms of workplace mandates, if employers choose to adopt a vaccination program on site, there's a lesson learned about how to perhaps reduce some of the conflict that they might find. And because John Moore had no conflict, there were no strikes. I mean, it was, they communicated a caring message that you as an employee have a right to work in a safe place. And you go home to your families after having taken mass transit, and your families have a right to be safe. And our residents have a right to be safe. And that was a sort of, I thought, a nice wraparound caring message that has really been proven to be very effective for them.
Excellent, excellent. And you both touched on very similar themes as far as putting these concerns and barriers into certain buckets, per se. So you talked about access, you talked about having other priorities and not being able to get to a vaccine site, even if the vaccine is made available to you. Dr. Dan talked about, sometimes coming too late. Basically, you're in the ER now. You chose not to vaccinate, you're here now. Trust, systemic racism, the issue of illegal immigrants. And also, you touched on misinformation and disinformation that continues to penetrate communities of color and is ever so pervasive. We hear things such as the composition of the vaccine is of concern, vaccine safety is of concern, long-term side effects. I know we've put in the chat a question to those attendees asking, what are some of the things you hear? But again, I wanted to, find out from Dr. Dan, what are some of the things you're hearing and what are you using to combat some of that misinformation and disinformation?
Yeah, thank you. So this is where, some of the work has been going on, and what we call the infodemic. It's been very challenging. It's been draining for definitely many of my colleagues and myself. Trying to, it's almost like sometimes you're shadow boxing, or you're fighting with one arm behind your back. You're trying to address the issue of systemic racism within the healthcare system and the government at large, and trying to work through those while you're trying to also address the pandemic, and more specifically with the patients in the population and the community. To the extent where people say you're an operative, or we can't trust you, or you're not woke, or you're just following orders and things like that, and we're like, no, this is not what we're trying to do. We're trying to save lives. But there's just an overwhelming amount of disinformation and misinformation. Misinformation being the information that's just not accurate, that you ended up sharing with other folks that you don't know anything about. And disinformation is the intent to literally thwart our efforts to save lives for your own political agenda or a group's political agenda. So I think there's a distinction that needs to be made, but the bottom line is that it still compromises care and it can affect lives. In fact, we just saw an example as of yesterday when Nicki Minaj, and a wonderful hip hop artist that a good number of us enjoy her music, or at least appreciate her talent and her efforts. But then when there's you have so much of a crowd and a following, you have a certain responsibility, and where there was information being shared that wasn't accurate, and it needed to be called out. And there some of those things that I don't think she had any ill intent. However, you have to kind of take a step back. Either if you're not sure, don't say those things, and just factor in the fact that you have a big following. So that's a microcosm of some of what we're seeing, right? We see celebrities and stars who have lots of followings who can be a challenge to the system. I experienced this on IG. I experienced it on Clubhouse, and when we're having conversations. So what are those things that we're seeing? People are literally saying there's something in it, there's poison, or how do you know what's in it, or it's going to affect my nucleus? And I'm like, where's your nucleus? Do you actually know where your nucleus is? So we kind of ask that, but we all have to be humble, but also have that human side where we give respect, and we have to have compassion and give each other grace. It takes a process. Yours truly involved, even with all the years of experience. My whole thing was, let's reassess this vaccine before I put my stamp of approval on it. And I was feeling that way early on in the beginning of 2020. If you follow my IG TV series, I literally am saying, well, I'm going to see the data first. I'm not sure about the vaccine until I see the data. So we all had to go through that process of rationalizing, thinking, processing. But now that we have the research, the data, and all those things, we're able to make those decisions. I think we have to give people grace to get there as much as we want to speed them up to get there where they aren't, with education, with compassion, and sometimes with mandates. So those things all working together may help us. But yeah, those are some of the things I'm seeing. A lot of hesitancy, a lot of disinformation, literally big rooms and big populations, big groups of people, celebrities with great followings, just on a different path with regards to the vaccine and leading people in a certain direction. Talk less of the fact that they have access to resources, the celebrities that are, but their followers don't. The celebrities may be isolated, but their followers might not be, and just mixing. So they're like, oh, well, I'll do the same thing. So those are some of the challenges. And for colleagues, we actually get attacked. Some get attacked, some get nasty messages, they get stalked. So there's real risk out there. So you have to then take your mental health also and think about that too. How do you take a break from that? How do you combat the misinformation, but also when to engage? Sometimes you have to stoop to conquer. How do you engage? Do you find people's why or their why not? So you can meet them where they are without having to be judgmental and trying to, get that information and unravel the story around once you identify their why. But sometimes it's that one-on-one conversation. I've experienced that a lot. Thank you.
Thank you, Dr. Dan. And that's very, very insightful. And we're hearing that over and over, finding out the why, finding out from that person the why, because we've come to a point now where there are several people who are in the wait and see group, meaning they wanted to wait and see what would come of the data and the safety before they made a decision. And some of them are now getting vaccinated. I can attest to that with my own family members who finally are getting vaccinated. And there are some people who are saying they still do not want to get vaccinated. But again, we cannot be judgmental. As you mentioned, we still have to be empathetic. We have to listen, be mindful of our own mental health. So you all have touched on some really, really great points. I know a lot of people have put this in the chat, and we want to get to some of the chat questions, etc. So before we turn to that, I just wanted to talk about, in terms of vaccine equity, what do we face with the upcoming flu season fastly approaching? We know that the flu and COVID-19 shots can be given at the same time, the same day. And how do we get people to understand the nuances of the two diseases, understand the protective effects of getting both shots on the same day? So I'll start with either one of you.
Yeah, I would like to comment on that. And first of all, about flu, but then about the messages and the myths that are there, because they could surface with flu as well. If we go for co-administration, then people are worried that they've got two bad things going into their body at the same time, and how might that affect them, and so on. So first of all, with regard to flu, I actually think that in this community that flu presents an amazing opportunity. Because if you look at immunization rates in Black children versus Black adults, and in Hispanic children versus Hispanic adults, children are much better immunized. So among Black children, 60% get flu shots. Among Black adults, only 39% do. So that's about 2/3 the number, so the percentage-wise, between children and adults. And there's something similar with Hispanics. 66% of Hispanic children get flu shots, but only 37%, of almost half, or about half, of adults do. So something's going on here. People are protecting their children from flu, but not from themselves. And who knows, it could be, well, CDC has written that they think it's about insurance status, but we know that flu vaccine for children is free. And I don't know about the neighborhoods and neighborhood pharmacies that serve the minority community as well. But every place where I drive and look, there is a sign out front at pharmacies and grocery stores telling people the flu vaccine is free too. Not just COVID, but flu vaccine is free. So, you know, they're trying to entice people into the store to spend money. And the flu shot is an easy way to do that. So I think that what we have is an opportunity to hook into what parents or grandparents or guardians feel about protecting children, and talk to them as well about if they get immunized, it protects them as a family even greater and allows them to continue to be on the job and do the responsibilities that they have. Now, in terms of working on the myth side, I actually have a wish list of 3 things. So the first one would be people who are developing the messages to counter the myths need to stop using the myth fact format. Research on messages and communications indicate that when you do that, people remember the myth. They don't remember the fact. Now, I took a look, there's 51 million Google hits about vaccine messages. And I did look at a number of those that we would all consider to be authoritative because they come from the top medical organizations and public health agencies and schools of public health. All of them use the myth fact format. If you're having a hard time kind of understanding that, I would encourage you to find a topic you don't know a lot about and check it out and see for yourself how much easier it is to remember that bolded myth that is followed by several paragraphs of content, some of which, by the way, my second. So that's the first wish on my list. The second one is an absolutely up-to-date list of those myths and the facts to counter them that is instantly and easily available to clinicians like Dr. Dan and the nurses in public health clinics and everybody who's involved in this vaccine enterprise, because you never know when the next one might come sailing over the transom or walk through the door with one of your patients. And I don't know about you, Dr. Dan, but I have spent a fair amount of time, running down certain rabbit holes to try to find out what the truth was. So I would like that to be up to date. And my third wish is if it could be literate, then that same information would be valuable for patients in the general population. But that's the other thing I notice is that not a lot of these myth fact type statements are literate. They're all written at a very high readability level. Even someone like me who's familiar with the topic and is relatively educated still struggles to get through some of them. So it's going to take some wordsmithing, but in fact, those message experts are available, and we could, I think, transform this discussion if we could master this part of the challenge that we have.
Great. Thank you, Dr. Crooks, for sharing all of those. And we'll take note of those myths versus facts, not putting them together in that format, keep them up to date, and definitely keep them literate at a health literacy level that everyone can understand and learn from. Before we turn to Brittany, I just wanted to ask Dr. Dan to comment on the co-administration of the flu and COVID-19 vaccines, what he's heard, what you think are some of the challenges, et cetera.
Yeah, thank you, and great points made earlier. I think so. I would emphasize for people to go to the www.cdc.gov website, where it actually has information on the vaccination and actually addresses co-vaccination. It is important. Children are used to getting vaccines. Parents are used to giving their kids multiple vaccines, albeit they might not want them to get all like 5 shots in one time. They might do 3 or X number of shots. So it's not something new. You can do it, and you would go to the CDC website. So do not let that preclude you from getting the vaccine. Now, of course, you want to make sure you talk to your doctor or go see your doctor to get these immunizations. But one of the things that at least we try to know is how do you tease out whichever symptoms or what could be causing what? And those are some of the challenges. So I want to put that out there up front. What's causing the fever? Where is it because you got the shot and your body's responding as a normal or expected immune response, that you might develop a fever after a shot? People can do that. Is it the flu vaccine or is it the COVID vaccine that you receive? Which one it is? Sometimes you can't tease them out. But the big picture is really protecting yourself so you don't return to the emergency department as a patient who needs a tube down their throat. So I'd like to make sure we get into the practicality of those things. But you can co-administer them, meaning give them at the same time. And they all have similar kind of symptoms, albeit different disease processes, where they may present with some of the similar symptoms and then gradually differentiate themselves by the way the disease process goes over a period of time. So do not let that preclude that. I also understand that we are getting into the season where we're going to see other viruses, such as RSV, bronchiolitis, which can present with respiratory distress or difficulty breathing. And you would be getting the flu shot, you get your COVID shot. If for the kids, if it's appropriate for their age, we're still doing studies in that, right? So that will be coming out later in the fall if everything goes well. But with regards to the older kids, they can still get the COVID vaccine and they can get their flu shot. For the older population, you can get both. Again, make sure you speak with your doctor. There aren't any major contraindications for you getting those shots. You don't want to be the one who has to come to the hospital while we're surging and while we have this increase in volume. So you can actually prevent that from happening by doing that and at least prevent your risk of severe disease also, even if you had a mild set of symptoms, maybe 2 or 3 days, as opposed to having to be in the hospital, having pneumonia, or actually being admitted to the ICU, intensive care unit. So those are some of the challenges, but yeah, it's they're all here. So don't get it twisted. We got flu, we got RSV, and we got COVID, and the other viruses, the other thousands of other viruses. As cold weather kicks in, this is when they're optimal. Watch out. So be careful and don't add to the surge burden, but try to prevent that from happening.
Some excellent words of advice. Thank you there, Dr. Dan. You clearly outlined the importance of getting both your flu and COVID-19 vaccines. And just a point of clarification, because I see some comments, they're not in the same vaccine. It's one separate flu, one separate COVID vaccine, preferably one in either arm.
However, there is a point. So whoever brought that question, excellent question. They are working on a vaccine that has it combined. That's not ready yet. That's a great point.
Exactly. Thank you. Thanks for clarifying. So at this time, what we'd like to do is I wanted to introduce my colleague. She's co-moderating for this evening, and Brittani Nelson, and I will ask her to introduce herself, and she will then move on to the Q&A session as well. Thank you, Brittani. And thank you, Dr. Dan and Dr. Crooks.
Yep. And also, thank you to our panelists. So I have about 10 years of public health experience. I'm sorry, my dog is whining in the background. But public health experience from food safety and regulatory work to harm reduction in opioid and substance use to community engagement. I did recently graduate from St. Louis University with my Master of Public Health. My concentration was behavioral science and health education, and I am truly passionate about improving quality of life factors for Black people. So we will move on to our Q&A section of the webinar. So how do we use or how can attendees use the tools presented today in their communities?
Yeah, I can share. So there's several different things, actually, at least two things I want to highlight. So we talked about being a health champion. You can sign up to be a health champion to be able to be basically, or how you qualify for it, if you're a health advocate, any disease process or health issue that you really have a passion about and you want to make a change or a difference in people's lives about it, or policy, whatever it's related to that you want to make a difference for the good, you're welcome to be a health champion, and we'll give you all the tools, training, and all that. So please make sure you sign up for that. So check the chat. You'll see the link there. Go sign up and be a health champion, a health warrior, a health advocate. So it's really cool. The other part is that within the Center for Sustainable Health Equity, they partner with CDC and has been able to actually have these wonderful tools that actually help and bridge the gap between racial divide and vaccine equity piece of that. So you can check that out and sign up and register to be a part of that, where they actually give you tools, training, literally from your primary care settings, your hospital settings, and they'll give you all the basically metrics and measures and things to do so that you are part of the solution and part of that whole process. So definitely check that out. Those are some of the tools. I mean, literally, there's a wealth of information, even just on this call, as Glenna shared with us also. So there are lots of tools, lots of information. That's why we're having this conversation, and everybody's taking their time out to kind of share that with you.
Okay. And the next question is, what do I say to people who just refuse to get the vaccine? What would your advice be? And
Dr. Dan, do you have a take on that?
Yeah.
Always have a take, but ladies first. I'm waiting for you to tackle that. This is your area, so I'll let you go. And if I have anything to add, I'll say.
All right. What I would do to comment on this is to turn to the work of Casey Albertson, who was one of our guests in an episode. Now, he's a market researcher who has segmented the market into 5 different groups. And depending on, and by the way, it might be difficult to know where somebody fits, although I'll tell you a little bit about them and maybe you'll be able to guess. So the first group he calls self-achievers. These are people who are very proactive. They like plans. They like to track outcomes. They trust their doctors. These were the first people to get immunized. So chances are you're not running into them today. They would have moved heaven and earth to get that shot. Now, and they are one of the 2 groups that are most likely to be immunized. Now, the second group is one he calls decision takers. These people are pretty reactive. They didn't run out and get the shot. They need clear guidance from a trusted expert. So this is why keeping people within their medical home, pediatricians talk about that, but it's important for all of us, is really so important to this particular group, because they will act if a trusted source tells them that they should. Okay, so in that case, it's just a matter of whether they have run into that trusted source yet, and you could encourage them to do that. Not a bad thing to ask anybody. Who do you trust? Is there somebody who provides you with healthcare? You do, and what have they said? Okay. Now, there's another group he calls balance seekers. they will be likely to get immunized, but not right away. So they're not like the big group that's running out there to do it. These are people, they're a little bit proactive, but this is the group, by the way, that is the least likely to get a vaccine. Now, and interestingly enough, there's a lot of people in healthcare in this group. And aren't we seeing that as some of the mandates, roll out? They want to look for new solutions, they want to find their own way, and they want to be the one to make the decision. Now, here's what's driving them, though. They care for others, and they sacrifice for themselves on behalf of others, whether that's their family, their community, their workplace, or their patients. So calling on the interest they have to be there for the loved ones in their life would be an effective way to start having to have a conversation with them. Now, there's another group he calls priority jugglers, and I've kind of already talked about them. They've got a lot going on in their life. And so to, address, leap the hurdles and get past the hurdles is really not going to be easy for them. So getting a vaccine is going to be on the back burner until it gets to be easy, until we have a van outside the Walmart, for example, or a clinic in a workplace where they can go. And then finally, there's a group called willful endurers. And this is the single largest of these categories. They are the most reactive and the most disengaged, and they are 1/3 of the American population. These people live in the moment. They are convinced that they can survive and get through anything, including pain. And so telling them horror stories is really not going to happen there at all. So that's the toughest group to crack. And once we're there, I think it's hard for me to advise, because unless you know the particular connection, excuse me, between you and that person, it's going to be very different if it's your spouse or your best friend or your sister than if it's an employee. And I think that is now where we need to start parsing through the more specifics in each one of these groups. And by the way, that is a worthwhile thing to do. Anybody in the vaccine business anticipated the red-blue state split that we are seeing. It happened in swine flu. So red states had lower immunization rates and higher death rates than did blue states. So this was predictable. It'll happen again. And so it's worthwhile for us to tackle this particular issue and get it solved.
Thank you, Dr. Crooks. Dr. Dan, did you want to add to that?
Okay. No, I was well covered.
Okay, thank you. So, Dr. Crooks, I know that you mentioned having plain language for those that are claiming to do their own research. Where can we direct people to find some of those, resources?
As I've mentioned earlier, there really is a lot of information that has been made available by very knowledgeable and authoritative clinical groups and public health groups. What it needs is a big dose of making it literate so that people can really understand it at the level of science or the level of language that they understand.
Thank you. So we'll move on to how do you advise to best reach particularly African Americans who may avoid completing surveys to gather information about their views to drive change in vaccine outreach and outcomes?
I'll say just one thing, but I'm going to lateral to Dr. Dan. I would say that clinicians like Dr. Dan have their finger on that pulse because they're talking to people over time. And he has commented tonight that he has seen some shift and change over time. And I think Dr. Beysolow, you mentioned that too, about now, especially that the Pfizer vaccine has been fully approved. It'll be interesting to see if we get yet another bump when the Moderna vaccine or others are fully approved. But I would say that understanding that resistance to completing surveys is a really good first step, because that helps you be aware that there are things you don't know that the community may be feeling. And my suggestion for that is social listening. Social media is a really rich source of data about things that people are saying to one another. Now, granted, we know that there's some mischief happening in social media in terms of spreading myths, but there actually are some really good tools for monitoring social media and detecting change over time. So we could employ those.
Yeah, I would add in addition to that maybe some of also these surveys are shorter and to the point. I think sometimes people, adult learning, you have certain attention span, and this what one of my colleagues calls the microwave attention society. So people want to be done with the stuff, so they'll just kind of check yes or no, or if it's asking more detail, they might not open up. But I think also prepping them for what to expect on the survey when they have that one-on-one conversation with their clinician or practitioner, someone that they trust. Hey, we really need you to fill this out. It's important because we need this data to be able to make better decisions or to inform our decisions. Is there something that could have gone right and things like that? The same thing even post-vaccination when you get your regular shot, they watch you for 10 minutes or whatever the time frame is. Those are the times while people are doing that you may give that to them so they actually can fulfill that while they're being watched adequately. So making it convenient, giving them the expectations, making it shorter, all those things and will be helpful. Of course, in it being at the level of the language, maybe at that 4th grade level for the general population to make sure that people actually understand it. Some have actually we've done this with research, where we actually have a coach or a liaison, that is, you have an additional staff without getting into people's personal health information, but actually coaching them through, if there's something that you have trouble with the question or something to help clarify that. So sometimes that is also helpful. Okay.
All right, so we'll ask one more question before we wrap up. What gaps or issues do you feel where more research is needed regarding the vaccine hesitancy or confidence in minority communities?
Well, aside from what I mentioned a few minutes ago about becoming far more specific about the messages that we will use with various segments of the population, I would say I'm not sure we need more research. We already know more than we are putting into place. And what we really need to do is act on those things we already know. That's keeping people in trusted channels, making the vaccine available, making it clear that it's free, finding those ways to connect the community and community leaders with the populations that they care about. This is not the first time that people have attempted to reach out to communities of color. And, with other conditions, we've learned a lot, whether it's the influence of barbers and hairdressers, for goodness sakes, in hypertension care and the difference that made, or with mammography. We've got some models. We just need to act on what we already know. And I'm convinced if we do, we'll get farther down the road faster.
All right. Thank you, everyone, for participating in this discussion and your time this evening. I just want to reiterate to, you can reach or connect with all of us in the information that was dropped in the chat earlier in our discussion, as well as the resources that you can implement in your program or your community.
And also just wanted to reiterate again, a big thank you to our organizers for tonight, the NMQF, to Kristen Hobbs, to Brittany Nelson, and to our panelists, Dr. Dan and Dr. Crooks, and to everyone out there, thank you for attending. And also wanted to remind you, please continue to wear your masks. This is not a one-step approach where it's just vaccine and nothing else. Continue to wear your mask, wash your hands frequently, social distance when you're in crowded situations, and get your vaccine if you have not received your COVID-19 vaccine, and get your flu vaccine as soon as it's available to you. So thank you all so much.
Thank you. Bye.
Bye-bye.
Well,